Okay, welcome everyone. We are so grateful to have you here for Sustaining Mental Health Repair, a Maintainers Movement Fellowship event hosted by our amazing fellow, Himani, who is in the public health track for this year's fellowship. I'm Liliana. I'm the Community Outreach and Events Coordinator for the Maintainers. I use she, her pronouns, and it's such a pleasure to be here with you all today. The Maintainers is a global research and action network interested in the concepts of maintenance, infrastructure, repair, and the myriad forms of labor and expertise that sustain our human-built world. If you want to learn a little bit more about the Maintainers and our code of engagement, which we like to share at every event, it's basically our values in practice. We invite you to check out the link below. And so this fellowship event is one of the amazing programs that the Maintainers offers. And so the Maintainers Movement Fellowship is a fellowship that advances the movement for maintenance thinking and action by supporting practitioners and researchers in their own tracks of maintenance and repair and care work. So today, your event lead is Maintainers Movement Fellow Himani in the public health track. And again, just a little bit of housekeeping before we get started. This event will be recorded for our collective reference, which will be sent out to all of us next week. And if you have any questions during the event, please feel free to type them into the chat, and Himani will be facilitating us during the Q&A section at the end after all the speakers have shared. So without further ado, please feel free to share in your name, pronouns, where you're calling in from, how you heard about this event, while we pass it over to Himani.
Thank you so much, Liliana. A very warm welcome all of you. My name is Himani. I'm a mental health professional and I'm a public health fellow for this year's Maintainers Fellowship. And today we are talking about a segment of the mental health system, public mental health system, in fact. Yesterday was Mental Health Day, and today we are taking that theme forward and talking a little bit about concern that especially pertains to a delivery model, that is helplines. So public mental health interventions, public interventions in the mental health system overall have been in a rising need in the last couple of years, and more so as we face global crisis and we realize that the gap between the providers and the public is growing and needs something that bridges it. We will talk about how different systems have been incorporated to help this gap. But traditionally, the system for mental health has included psychiatrists, therapists, maybe nurses, social workers, and physicians to some extent as mental health providers. But public mental health crises, one after the other, have brought up the point that there needs to be something that serves to that last mile of care. And helplines often are the resource that do that. And not just as crisis intervention, in fact, as the first point of contact for a variety of diverse concerns. And we learn more about what those concerns are, more about what that delivery model also is from our experts in the panel today. All of you have been the drivers of your respective helplines, and especially during the COVID-19 pandemic, and have responded to this crisis in the form that reached a large number of people and also served to such varied variety of concerns. A very warm welcome to all of you. We would love to hear from your expertise and wisdom as we go ahead. And first of all, as we start, I want to introduce all of you. We have Ms. Devika Kapoor, Project Coordinator for Mental Health and Samvad Helpline for Project Mumbai. Mr. Sidhhant Khurrana, co-founder for Mindpiper and Program Lead for COVID Response Helpline. And Ms. Meghana Jadhav, Program Associate, MannTalks. Again, a very warm welcome. Diving right into the conversation for today. I want to ask all of you, I understand you were in different phases with your mental health interventions when the pandemic happened. Of course, the pandemic brought in such panic, everybody responded to it in such different ways. And We were all worried about our own safety, our own health and well-being of others around us. And I see some of you were already working on helplines. Some of you initiated that after the crisis. And I want to hear from you. Maybe, Meghana, I'll start with you. You were already working on this helpline and maybe had to adapt to the crisis in some way, and really want to understand what that early phase was like. What was happening? What were your expectations from this? What did you expect, or what did you aspire when this change was happening?
Okay. I'll clarify one thing. So the helpline that I was working at MannTalks, I'm still working with them in some capacity. We actually started right in the middle of the pandemic. So the founder obviously wanted to start early on, but by the time we could start, the pandemic and the restrictions were already put in place. So we did actually start right in the middle. But I did work at a helpline, another helpline called iCall. I worked there many years back when, of course, like the pandemic and that situation wasn't there. It was back in 2013, 14. That's when I worked there. So I can tell you the difference. Obviously, a major difference was that a lot of discussions that came in when working at MannTalks, which also again started like mid 2020 in September, is where we had like the soft launch and the proper launch in October. Of course, a lot of the concerns were around the health related anxieties, but a major angle to it was also finances and job loss, a lot of loss, a lot of grief that we noticed, like a lot of them would call and acknowledge that I know, like, you can't really get me a new job, but I also don't know what else to do at this point, right? Like, who else to go to? So grief, I would say, was another common theme that we noticed. And again, not just a grief of course, losing someone, but rather a grief of like what we call disfranchised grief, like grief of losing opportunities, right? Losing your financial stability, right? Or sometimes the grief of also losing a possible future that you envisioned for yourself. Those who did not lose jobs did, lose the chances of, say, some sort of progression, or they had to make some major changes about how they are perceiving their future now. Of course, along with just like a general anxiety that was there about, okay, how am I supposed to handle now? A lot of people shared that some of them did have a newfound anxiety about medication, about hygiene. Again, COVID being a very contractable disease, there was a lot of anxiety suddenly about hygiene. A lot of people were suddenly like worried about their family members, themselves. So I would say this was the change, whereas the earlier experience, I would say, didn't. Well, of course, there were still people who had anxieties about health and all of that. But again, because there was this larger context of pandemic wasn't there, the calls there in my earlier helpline work were a lot more balanced, right? Like there were some calls which are about crisis, safety of the person and stuff like that. And then there were some about relationships and personal concerns like personal growth and job and stuff like that as well. But here you could sense like that backdrop of pandemic sort of being there, and the loss also that people experience different types of it as part of going through the pandemic.
Right. Yeah, I think that's, thank you so much for clarifying that also. But I think, like you said, that the difference is so noticeable between your earlier work and this, that health anxiety and anxiety about just how unexpected and unknown all of this really was showing that. Sidhhant, I want to understand from you, what was that experience like for the helpline that you initiated, and what was that like for you guys?
Thank you, Meghana, for Imani and Meghana for sharing. So, just building on what Meghana shared, I think the journey for us started in late March 2020, in the pandemic, and the first lockdown was just announced. And I remember this is 24th March 2020, and that's where, as a founding team, we were wondering of how can we contribute to this. And having had access to the state government resource person before, we felt that could we attempt to reach the people who are the most vulnerable margins. We know that mental health, when quarantine is the only way to break the spread of the virus, is seen as the pathway to break the spread. People who have limited wherewithal will have it the worst. And at that time, it's absolutely essential to work in partnership and in collaboration. And when there is immense chaos and anxiety which exists about the very core survival, could we look at being that support system which the people can access? So I think on 27th of March 2020 is when we had reached out to the official state government of Delhi. And I think it was just a remarkable, I think, support we received from them. I think everyone worked at like a remarkable speed and agility to have the helpline launched in about 4 days' time. And on 4th of April is when we went live. And the idea and the focus was towards children who study in the government schools of Delhi and their parents and the people who are the daily wage earners in Delhi. That's the primary audience that we had looked at focusing upon. And also because there was so much of information asymmetry, there was a lot of myths, misconceptions. No one knew where to really go if someone is showing symptoms. There's an absolute need for a credible, I think, a support system to just come in and to just provide that support. And I think that's where we as COVID response came in. The idea was that it has to be beyond an individual organization. So that's where Mindpiper chose not to do it under an individual organization name, but to build this collaborative initiative, because we recognize that it's something which we as an individual entity would require many, many more hands together. And we were fortunate enough to be supported by a lot of champions of mental health, people, the professionals, people who are people who lived experiences and state officials themselves. I think the best aspiration that we had while discussion with the government was we would be able to support about 250 people in one day. I remember when the government did its outreach, and the scale that the government has is magnanimous. The single day we received about 10,000 calls. And that's something which nothing would have prepared us for. And so we had to do a lot of rapid prototyping and just keep adapting to how their needs were. The calls that we would get were from people who hadn't had a meal for the last 3 days. Children who were just left alone in their home because their parents had traveled outside and they were stuck in their own geographies. And no one in the neighborhood wanted to help them. So I think the world at that time saw the best of, and also the parts which also make us wonder of where the world is leading to. I think the best of, and also the other side of the coins were also visible deeply in that time. There are people who just stepped up and just were there for all others who were the strangers, and just wanted to help in any way that they could. And on the flip side, we also saw that how the individualism of my own survival and came out to be. The concerns and the call that we got in were ranging from members who had medical emergencies, who were trying to get an ambulance but weren't able to get one support for almost 72 hours or more. Members calling in that my family member is, or my child is stuck in a different state. Could you help me get a pass? And that's where the core, where we anchored our support was in terms of we can anchor it on crisis counseling, psychological first aid, because, and at the same time, on the back end, build support system in which the people who are the first line of engagement, who are all MA psychology or greater discipline people, are equipped enough to also, while being able to offer their expertise support, we also be able to offer credible information, which is in real time being adapted to the state government resource persons. And we built in a loop in which every escalation, like I remember a case of a expecting mother whose delivery was due and wasn't able to reach the hospital for I think 3 days at a stretch, and it was an immediate crisis. We had to just get her the right support, and we activated every channel in the government system to get her the right support. And I think that's also where kudos and credit has to be given to the government as well. Each case that we escalated to the government was resolved within a 48 hours time, and there was 100% resolution rate. And what we also did was these therapists as well, right? Because they also were living through the pandemic themselves. We ensured that this case success as news also got input back to the professionals themselves, so they could knew that their efforts matter. What they do is really contributing. At the same time, ensuring their own well-being is taken care of by having access to mental health professionals for the care providers, having training and learning circles for these professionals, and having peer supervision on a daily basis, and also limiting number of hours that they're even active on the helpline. We ensure that no one was working more than 3 hours a day and they had to just be online on an alternate day basis. And that's where I think the mental health communities just came together. I think when we put out the call for supporters, I think in about less than 2 days time, we had got about 1,000 people signed up. And I think this is the power of, I think the desire to be there for some other individual just came about. And I'll add more in the forefront, but pass it back to you, Mani.
Awesome. Thank you so much, Sidhhant, for sharing that. Really brings out all that was happening at such a fast pace, but also bringing up, like you said, people's willingness to contribute to it, willingness to help each other out and really deliver to the crisis. And just taking the same question to you, Devika, what was your experience like? How did this helpline come to be? Was there a need that was identified, or did you have to adapt to your mental health initiatives to this crisis? How was it for you guys?
Yeah, thanks so much, Himani, and thank you both, Meghna and Sidhhant, for contributing as well, and thank you for having me here. My experiences are eerily similar to Sidhhant. So every time that he was speaking, I was like, yes, same. I worked with an organization called Project Mumbai, and we also associated with the government of Maharashtra to set up a helpline for people who are experiencing emotional distress. And much like Sidhhant's endeavor, we also put out a call for people who want to volunteer, and right from training the therapists to ensuring that each case is also documented, because that's a major part of how we maintain history as well, to what the handover will look like, what the shifts will be managed like. I think all of us got together and started to think about it, because we didn't have this system earlier. And it was actually a very humbling experience to know that how ill-constructed sometimes realities are, and how less resources are available. And while resilience is great, but it was very, very humbling to also see that how most of us just rely on that internal resilience, and there is such lack of external structure that is present for any kind of health, be it medical or be it mental health as well. Having said that, I think I was also pleasantly surprised to see the support that we received from the government for a mental health initiative, because I feel that usually in crisis, mental health is an afterthought. Nobody thinks about mental health whilst a crisis is happening. We're all geared towards safety naturally. But I think that this time, when we took an approach which was far more synergized, that yes, while people are, being taken care of physically, it's also important to take care of it mentally, because I think we went through a mass sort of experience of anxiety, uncertainty. So I think that really opened up people's minds towards mental health, and also helped in somewhere or the other reducing the stigma that persisted a little bit, at least, that okay, yeah, there is something called as tension, there is something called as stress when that happens, and we need to do that. But the process of setting up the helpline was, of course, had to be very, very fast, like Sidhhant was also mentioning. We also followed a similar timeline, and I remember that because all of it was online, we would have trainings for the therapists, because we would set up protocols that, if there is a threat to harm, what is it that we need to do? Not only that, but in various regions of Maharashtra, which are the prominent districts, what are the facilities available in that district, making a list of those resources, making a list of resources, or just informing the counselors of the schemes that the government has announced, because there were a lot of misinformation floating that, hey, if you will get these many kgs of grains, go here, go there. There was a lot of misinformation floating. So I don't think the training was simply on mental health. The training was on so many other aspects as well that we also tried to do. And we were also learning. So it was in a way that we would learn something new, and then we would be like, okay, now we need to communicate this to the therapist. Now this has been the new development. So I think we were all really trying to function from a point of view of what we know and just taking the next step. I don't think the way our helpline was built, it was envisioned with, yes, this is how it will be staged and this is how we'll do. I think we took a very one day at a time approach and start to build it, because none of us were in this in a position like that. It was quite unprecedented. So we thought that instead of spending a lot of time conceptualizing it, it might be better to execute and learn from the experiences that we've had. So that's what I wanted to share, given the question.
Thank you so much, Devika. I hear all of you sharing this, that it was very on the go. The developments were happening every day. And very rightly so, that everybody was learning together. And such an example of not just being the trainer or the teacher in this circumstance, but learning at the same time, going through the same crisis, obviously, also with our own lives, with our own families, and everybody involved in there. And really makes me wonder if, like you all said, that, there were volunteers and there were therapists who just rolled out a call, and people said they want to be a part of it. And I'm just thinking along that do you notice that there was a difference in terms of, I would imagine, obviously, helpline model itself is very different in terms of how any intervention happens there. But do you think therapy also changes, or any type of psychological intervention also changes when the crisis is so different? And like you said, Devika, so unprecedented. It's not like there was an existing protocol to respond to something like COVID-19 pandemic. And what was your experience for that? If any of you want to go, that's fine, or I'll just ask directly. But yeah, that's what I want to know. What was that like to also just be in the middle of it yourself while responding to it, and not just working with therapists who are responding, but volunteers and social workers and people who have masters in psychology, but not necessarily like a therapy training. What was that mix like?
Is it okay if I share? Yeah, okay. I think the way we also started out was thinking that, yes, we want to take people who are quote unquote qualified mental health professionals on the helpline. But we also soon realized that just because a person is qualified doesn't mean that they are also a match for the kind of work that we are also offering. Because all of us have our different schools of thoughts that we follow, and our orientation is different. And I think what we really wanted to do is really focus on the psychosocial element of mental health when we are building a crisis, as opposed to just focusing on a much more clinical perspective. Because here, the purpose of the helpline was not to cure someone. The purpose of the helpline was not to eradicate a concern. The purpose of the helpline was to hold the person in this time of uncertainty, and prove to be that one certain space that they can come to should a need arise, or should something go wrong with that as well. So I think there was a huge shift in the way that we also started to look at mental health, and also very actively started to make efforts to shift our gears and deliberately make actions to recruit people who have a certain bent and who can respond to that as well. So I think it was a mixture in working, and we had not just, while the people who were answering calls were therapists, of course, but our team had a mix of psychiatric social workers, it had psychiatrists, it had it had nurses, like you were also pointing out, some government officials, people who work with domestic violence, all of them together, because we saw cases across that domestic violence increased in this time as well. So many things that we had to think of, and I don't possibly think that a therapist or any therapeutic training or skill will be enough to deal with this. So like I was saying, it was a humbling experience, but also reassuring at the same time that we do need a multidisciplinary approach, especially in times of crisis as well. So that's one.
Absolutely. Thank you so much for sharing that, Divya. Like you said, that it's really teaches you how so much more than the model we are taught, the model that is commonly known for mental health. And you mentioned psychosocial, and really brings out how these different elements, everything from domestic violence, and like Meghna was mentioning, financial burden or possibility of loss, disenfranchised grief, all of this really showing up in terms of what people were dealing with. Meghna, if you want to add to what that experience was like, especially dealing with not just mental health, but a broader psychosocial health. What was that like for you guys?
Yeah, I think one way I think somewhere MannTalks differed from these helplines is, of course, it started as a very planned intervention. And we had to start as a helpline because we realized, okay, that is the need of the hour now, right? Like as an organization, of course, there were and there are still ongoing plans about a lot of on the ground intervention. But at that moment, and we decided that, okay, let's go with the helpline first because that's the need of the hour and that's like the best intervention we can offer at the moment. And I would say with hiring again, just like Devika said, right, like we also wanted to make sure that we are able to connect with people who are not only psychologists but also people, say, organizations that had some on ground support, and organizations that were connected to, say, medical professionals and such as well. So even our efforts were also to, while MannTalks did not hire people of other discipline, because again, being a starting organization, we could only, like, we started with 5 of us, so we could only like start with so much. But what we did was, of course, build a very strong referral system with the help of another organization. And with that referral system, we were able to build a good network of organizations or NGOs that are working on the field. So, because as you said, a lot of these calls would come in where, as a therapist, you can only do so much. Yes, you can hold that space for them. You can offer that validation. You can offer that emotional support, mental health support also that is needed in that moment. But grounding is not going to make the hunger go away, right? Like, and we also used to get these calls, right, where a family is not eaten in 2 days and they don't know now what to do. And like me and my fellow counselors, we would then just like legit like search the Google area of that and see if there's any langar, if there is any other such places, that we can direct these people to. So I do feel that as a therapist, what I noticed also as a program officer is that at least for time being, a lot of the counselors were also shifting into a role of a sort of a social worker, a crisis responder as well, which of course a lot of us are not really trained when you do your masters and stuff. So yes, we did have to also then learn on the job, okay, like how do you also maintain that balance of being a mental health professional but also shift into a bit of that role of a social worker in that moment as well.
Yeah, absolutely. Like you said, that it really brings up the limits to how we understand mental health, and pushed all of you and your teams to be so much more truly, in the real sense, be helping professionals as the profession is known for. And I'm listening to you guys and hearing this common theme that it was a lot of responding. It was a lot of responding to crisis, responding to problems. And I hear that those problems are not just mental health, they are everything on the board. And did you notice that people were also recognizing something as mental health, or was it mostly real crisis situations, like you're mentioning, the psychosocial aspects of things like job loss and finances and violence and all, or people were recognizing that they are feeling stressed or anxious or they're worried? Was that apparent, or you or your team as therapists had to bring that up? Sidhhant, what was your experience with that, especially the mental health part of it?
Right. I think much similar to what Devika and Meghna have already shared before, the approach had to be brief therapeutic of nature. And in most disciplines, one is taught about community mental health. I think this was a true hands-on learning for professionals who were involved of what community mental health really looks like. And it's very departure from what books and practice in the colleges. It requires one to don multiple hats. It requires one to be humble and to know that there's a lot of things that we don't know, and to not come from a space of expert, but both start from a space of acknowledgement and knowing the desire to help and support, while also caring for your own self. And in terms of the recognition, I think there were different phases, right, of also the pandemic. I think much of the months of April specifically was about crisis, immensely about crisis, when the strictest lockdown was in place. Because you also work different audiences. So from being a incoming helpline and when people were calling into us, we also did an outgoing approach in which people who were in quarantine were reached out by us actively. And that's where we did a paradigm shift, that in the burden of seeking help should not be in the person on who's already going through a lot. Can the state and the country and its government for the first time take a welfare stance and say that we will reach out to you, we will support you? And that's where when we shift this lens and approach is when I think a lot of conversations which happened were quite different from a crisis response. These are people who were in quarantine or were recovering from quarantine or had recovered from COVID. And when this data was coming from us from the state's database of Indian Council of Medical Research, these were people who had never ever shared about their worries about what would happen to my family if I don't make it tomorrow. What would happen to my child? What would happen to my own parent? I think that's where the entire, I think the space of sharing also completely changed. Because that's where it became coldly about things which were each of us were experiencing but were not voiced out. It became moving beyond the immediate here and now. It became a lot about that. I think this is extreme. I think the vulnerability which each of us was experiencing, and also a sense of helplessness and hopelessness, and to be shared with another person and just hold the space of the other person. And I think that's a lot what the professionals at that space offered, in terms of I'm going to be here with you, and this is something which is a experience I certainly absolutely acknowledge. And the individual on the other side is also not looking for a solution. They're just looking for someone to just hear them out, because they know that this is something which they can't voice to their own family member. Because if they do, the person will worry more about the person's already under institutional quarantine. I don't know what's happening to them. And if these kind of conversations happen in the Indian family structure, we know how the worry cycles just work like a domino effect. And that's something which I think was the most humbling thing to be able to be a part of, to move the burden of seeking help from the person already in crisis, from the state taking a welfare stance. I think in terms of, I think the multidisciplinary practice, which the other panelists already spoken about, I think that's also where a rights-based and a justice-based and intersectional approach really came in. And I think also common themes I'm hearing all through is in terms of there are people who already have the wherewithal to seek mental support, and those people definitely need continued support if that's what they desire and could benefit from. I think a lot of the efforts which I'm also hearing from the other panelists was directed towards people who had otherwise had no access or was for the first time they were engaging with the mental health profession. I think that was something that's very different about this pandemic. The people who were otherwise never touched upon by a mental professional would not even know different terminology, which is not for them to know about, right? Also, it's perfectly okay. I think that's something that's quite different about this pandemic in terms of the class, the society, which is also being reached out actively and proactively. I think that's something which was a remarkable bit. And I can only hypothesize what that happened. And my hypothesis was the same, was that it was a shared experience in which the people who were absolute of mighty power and money were as helpless and as just didn't know what to respond to as the people who were very limited wherewithal. Of course, the crisis and suffering was different, but the sense of hopelessness was a shared one. And that's where I believe even that bureaucrat who was had to work even in a crisis response from his own house recognized that this is something which is I'm also going through. How can I not say that I don't want to work on mental health anymore when a partner or non-profit or civil society organization reaches out to me? And that's how I think that it just brought about greater acceptance of mental health amongst people who were really decision makers, and was able to move away from mental health organizations or professionals chasing them to do something on mental health, to they proactively reaching out and say that we want to do something on mental health, can you help us? And that's where also the efforts in Karnataka, Pondicherry, and other states also try to strengthen the district mental health programs because that's where we felt this was an opportunity, not just looking at the current crisis, but can we also create better systems for crisis of the future? Can we use this opportunity when a primed stakeholder to also be able to create both a cadred workforce and at the same time a pathway to be able to really look at starting the catalysis of a journey towards a need for a stronger district mental health program? Because I think all of us share that no helpline can cater to a continued mental health support. It's something which can offer a certain very therapeutic support, psychosocial support, crisis support, beyond which you have to be able to link and refer. And I think that's something which we made a case for, and there were a couple of state governments who were quite, I think, open to the idea, and this also took those early steps. And that's the best, I think, work I've done in my life. I absolutely have no two thoughts about it.
Yeah. Really shows how so many modalities of work, so many different kinds of organizations, so many different sectors came together for this type of work. And this almost intersector alignment of what needs to be done to provide that kind of support had to be brought up and had to be learned by everybody, like you said, from the bureaucrats to last mile provider, the volunteer. Everybody had to be in on it. They had to perform to it consistently and also be humbled by it, really understand it as the time went ahead. And all of you have talked about the sort of cases you were getting, the sort of response that was being spent out. And I want to come to the maintenance part of it, how it was. Sidhhant, you briefly mentioned that how you looked at what shift timings would be okay, what would be something that doesn't burden the counselor or the volunteer as much either. What is the supervision going to look like? Devika, you mentioned that the trainings had to be online and you had to figure out how the handover would happen, documentation would happen. And Meghna, you mentioned how it was such a small team when it started. And I'm really thinking what it took for you guys to not just run the helpline, but also maintain the quality, the training, and the sheer essence of what this helpline has to do, not just for people receiving the care, but also the providers. So in terms of both quality, but also sustenance. What was that experience like? Were you involved directly with the training processes or the protocol processes? And if you were, what was that like? What were the basic pointers that you had to keep in mind, or things that you had to make sure that were being conveyed? Devika, what were your thoughts?
Thanks, Imani. I think, like I was saying in my previous sharing as well, that everything was very hands-on. So we were also learning as we were progressing. The first thing was, of course, to get at least the flow in place, that what will happen if a call lands, how will the call land at a particular person's phone, what will happen of that person, will they be able to receive, because these were also calls. The helpline was a virtual helpline, so it was not like it was not a physical place, so people were being sort of mapped virtually. Will that person who's taking a call, will they have a confidential space to take the call or no, to be able to also decide that, and then to be able to take availability from each therapist, that when is the time that you will have the most privacy and the most bandwidth to take a call, clubbing those things together, coordinating with the people who are managing the technology aspect of it, that this person should only receive calls during this time to this time and not during this time to that time. That was a very hands-on approach, plus at the same time understanding what will documentation look like. And what we really thought was, there is no point in looking at fancy softwares at the moment. It's really okay. We started with a simple Google Sheets, and we were like, we'll make use of this. This is a fairly efficient tool that can be used, and access to Google Sheet not only with the therapist and not with anybody else. We did some coding that you asked ABC things from a person, and that is the identifying information you will use to identify the caller next time. And if they wish to share their name, they do share their name. If they don't, they they don't. But for our internal monitoring purposes, also we had to discuss protocols that at what time does this mean that this person is an actual great threat of doing something to themselves or harming themselves, etc. So those protocols were also readied. And whilst we were making those protocols, like I was saying, having a very strong referral pathway is very important when we are doing when we're building a helpline, because an helpline, like Sidhhant was saying, can only do so much. After that, you have to refer out, especially for concerns that can't be solved virtually. You have to do that. So I guess the right from and what we realized once we started to get calls is that we were getting calls that were much more focused on, oh, there was a lot of calls around domestic violence, lot of calls around but people getting stuck here and there, not knowing how to get. So then we got someone to train people on domestic violence, familiarize them with the laws around domestic violence. What is it that a person can do in case they find themselves at the receiving end of violence, etc. And also when it came to missing persons or persons who were not tracked, what are some government spaces that they can go to register their complaint? Is there a protocol set by the state already? Because there was, like I was saying, so much misinformation, we didn't know what's really going on. So it was, I guess, right from start of the day to end of the day, it was just about like learning new things and researching more things, because I don't know what my colleagues' experiences are, but I think for me, we were also shooting in the dark. We were also just, trying to put one step in front of the other and hoping not to fall. I think we were just hanging by a thread there. And like I said, it was very humbling, because you feel like, oh, wow, I have a degree and now I know how to deal with mental health problems, and I'm a therapist and all of that. And then one crisis happens and then you're completely shaken from there. And so, yeah, it was very, very hectic, but also constantly adapting to it. So, yeah.
I think we all shared very public health sector smiles there, which is that you adapt to crisis and your training can never prepare you enough for what you face on the field. And absolutely agree with you, Devika, there. It's always like you said, that so much of it is coordination and planning and just making sure that whatever it is that you're trying to do and planning for really happens, really reaches those people. And I want to extend that question and ask you, Meghna, what was there then, if so much of it was happening as things were going, were there particular plans that were using to control quality or train people, or was it more like Devika said, that apart from the training, mostly about just making sure that processes are going on? What was your experience?
I think, again, the way this our helpline functioned, I think because, again, it was a much more pre-planned intervention and not just a response to crisis. I think, like, not just a response to pandemic per se. We were able to also were privileged enough to get help from another existing telephonic assisted helpline, who have been working in the field for a while. So they were really useful for us to help us set up these background processes and give us some guidelines about like how to go about it. But as Devika said, right, like, again, I call again was working in the pandemic for the first time. So one of the struggles that we had as professionals and as for my team was now learning to transfer all of these counseling skills that they have learned in a technology assisted model. And in this case, we are talking about telephonic model. Like some of them may have learned, not the batch that we hired, but maybe the next batch had some experience with online therapy, but none of them had any experience with telephonic therapy. So that is something that we still do, since the helpline is to some extent still going on, because we keep on intending to keep offering that support to everyone. And this is an ongoing training that happens internally to help counselors learn to transfer that skill, to use all of this skill in a telephonic or technology assisted workplace. But with regards to protocols and all, again, yes, it seemed like, now I look back on it, it seemed like everything was happening parallelly. Like, as they are getting trained, I am getting trained. I was also then making protocols for everything. And we had to be very innovative about, okay, but we cannot physically do much here. So now what would need to be the protocol like, right? Like how do I approach the required organizations? What would it look like? I genuinely felt like in some cases, especially when, as Devika talks about, safety related crisis, we genuinely felt like, okay, a little helpless about, okay, how much more can we do? Because even if it comes down to medical support, at that point, somewhere at least till the start of 2021 for sure, the medical support was also very limited. So then looking at, okay, what kind of, what would medical support look like here and how to access it, the channels, finding channels for it was also a trick that we had to figure out. But I think I do look back on it and feel like, okay, like, it also helped me grow a lot as a therapist as well, because I had worked as a technology assisted program, as I call, but we didn't have to worry about so much, because at the end of it, the world was not closing down. We could always like go to the place of that specific NGO, go to that office, talk to them about it, and get the help that was needed. And here we had to do everything online. And again, not all NGOs also had a chance to sort of switch to that online method. So the whole social sector, I feel the whole development sector in itself was like learning as we were going through it, like some NGOs were still sort of figuring out, okay, what would it mean for even their work, and like how much support can they offer as well, with now considering the lockdowns and stuff as well. But I also feel like sometimes counselors were able to be more creative about that support as well. They were able to actually think on their feet, and were able to find different resources. They were able to help the clients find different types of internal and external resources as well. And I'm glad that I feel like we all sailed through it, but I'm glad that we could help as many people as we could through that. But yeah, it was definitely it feels like it was a very like a fast moving thing for me, because a lot of it was happening very parallelly for me as well, because again, me being the program coordinator, I had to create a lot of background stuff, like as Devika said, I had to think about documentation, I had to think about continuity in some cases also. Even though it being a helpline didn't remain only a crisis thing for us, because we had people calling us every day, if not twice in a day and stuff like that, because for some people it was very overwhelming, the whole shift and the change and the challenges. So we had to also think about the documentation need to be in a way that the continuity is maintained. We had to think about some specific concerns, as I talked about, like the grief and stuff that came in. And I guess both of you will agree that another thing working in social sector that is supported by people is looking at data. And we have to think of, okay, what would that mean for us, and what would that reflecting on that data would look like for us? Yeah.
Absolutely. Absolutely, Meghna. So much to learn from what you're sharing. It's almost like I hear what you're saying about learning to be a different kind of mental health professional, growing into a mindset for a mental health professional, which is not limited to therapy rooms, not limited to even over a helpline, not limited to a certain kind of intervention model. And absolutely agree with what you're saying, that there was no time for anything for anybody. So it was all happening parallelly, all happening while you were delivering and learning at the same time. And really, the breadth of the work that you have managed to do, all three of you, is making me wonder, one, as you've all shared, how it has changed you as people as well, and as professionals as well. And what is it that I want to know you've carried from there, you've taken from these experiences that has maintained with you as a professional, as a person? Uh, can imagine a lot of it must also be the hard parts that are a little bit worried, a little bit shaken from the experience that it was. And maybe like you've all shared in some extent, some parts that were reassured about what is possible in a crisis like this. Sidhhant, what do you think? What has stayed with you? What has been with you since this learning?
I think when I was listening to all of it, it was like, gosh, you pulled it off somewhere. And that was a sense of hearing in hindsight to all these stories and narratives. I think what has certainly stayed with me, and we'll talk about something more about this in terms of the entire helpline approach. There's a lot of inward things that are happening. I think a lot of things are also happening outward. I think fundamentally for a helpline to also be able to do the services it desires to, outreach is absolutely a critical piece. By the time the audience doesn't know this helpline exists, no, you might have the best experts, give them the best training, build the best protocols. It's not going to offer anything support. And I think that's where both helplines of the present and the future have to be very thoughtful about in terms of not looking at outreach as an afterthought, but looking at, do we even have stronger outreach protocols, advocacy protocols, which can both provide consistent number of people coming in and knowing about this helpline and be able to reach people who need the support the most. And that's where it recognizes no greater enabler as a government. And I'm just going to use a sentence from a famous Hindi movie that which says, "Ye dil mange more." I think that's what I've stayed with. I think I've had a taste for scale work. I think that for the first 7 years of my mental health journey, I have worked with about 20,000 people. In that 1 year, I was able to work with 100,000 individuals. I think that's something which it's something which is a desire to do just more deeper scale system change work, because I think there's a need to also go greater upstream. I think a lot of the intervention when you speak of mental health and therapy is a lot of downstream approaches. When crises have already developed, a person is already experiencing a concern. There's also some people also having clinical diagnosis for it. One has to start looking more upward and upstream when it comes to, and looks at social justice, and comes at violence, and comes at abuse, and comes at offer of education. All of those key contributors, and which we talk about intersectional approach to mental health. And that's something which I have really taken up in terms of a desire to work more on these intersectional approaches, to go more upward in terms of also able to influence not just people who need the support and to have those clients come in and seek mental health support, but could we really speak to the other partners? So like an example, so if we have a philanthropy donor, could we speak to a philanthropy donor and say that, hey, mental health is something which not only a mental health organization should do, but every civil society organization should have a mental health lens and mental health approach. Or when we speak to an education bureaucrat, could we say that, hey, mental health is not just a department under the Ministry of Health. It's something which education should also look at, Ministry of Youth Affairs should also look at, it's something which Ministry of Disability should also look at. And to be also bringing those practices is something which I think has been a learning and something that I've taken forward. And I think that's where I want to put in the energy for the next decade of my work in the sector. I think, and that's a sense which I'm carrying today in terms of, just borrowing those words from that famous movie, Shershaw, Ye Dil Mange More.
Yeah, so that absolutely, like you said, there's so much to learn from, not just in terms of people and awareness for people who are seeking mental health support, but also from people who can be the agents of this change more structurally, more systematically, and absolutely echoing that thought. And I am really thinking about the fact, like, you pointed out that this has brought up the scale that never seemed possible before in kind of interventions that were happening, that you were doing and that were happening overall also, because I think when the governments get involved and the helpline model for a crisis situation is being initiated, it really was a different kind of scale and possibility that we are talking about. And I want to also understand apart from the fact that these initiatives happened and you guys pulled it off and you managed to take your teams through it and learn from it. What do you think is the step forward for initiatives like these, especially helplines responding not just to crisis, but to mental health as a growing need in the times that we're living in. Of course, I'm sure you would have experienced the limitations of the model, experienced the need that it has to maybe go beyond what it can offer, but also what it can do, who it can reach. And Devika, maybe you can share a little bit about what you think is the way forward for helplines, especially in the model that these are.
Yeah. Thanks for that, Himani. I think I started off my career as being a counselor on the helpline. That was my first ever job. And while the job comes with its own challenges, I think I've always believed in the concept of helpline. I've always believed in the concept of that is the biggest gate to access you can open for people, for mental health as well. So I do very strongly believe that while I know there is a tendency even among the mental health field to look down upon helplines a little bit and say like, oh, but helpline counselors aren't like real counselors, or they don't know how to do. There is a hierarchy that exists within the mental health professional as well. But I do genuinely believe that if a helpline is structured well, and if it has the adequate resources, right from funding to actually mainly from funding to people with good sort of intentions and people who are treated right on the helplines can really solve a very, very massive problem. It can lead to people at least not feeling isolated all the time and alone in their struggle. I'm not guaranteeing cure. I'm not guaranteeing any eradication. But I genuinely feel if done in a good way, mental health helplines run by sometimes professionals and sometimes also people with lived experiences, because who's to say that people who have a degree are better suited to be counselors than people with lived experiences, can run the helpline, and it can be a very sustainable model if done correctly. But a large part of it is the lack of structural support that is that we observe, right from people not wanting to invest in mental health and people not wanting to invest much more in mental health helplines, because there is a different approach to what helpline is, like I was also saying. And I think that once we are able to, if we are able to move past that hurdle, we should be able to keep this as actually a very, very viable and a potent form of resource that's available to people in need of care. So yeah, that's what I feel.
Absolutely. I'm well aware of your love for helplines, and I think your belief in the system really shows in how you're sharing, the possibility that they have and the potential to really provide for a wide array of concerns and diverse backgrounds, people, communities. Absolutely. And I agree with you there. Meghna and Sidhhant, before we wrap this larger conversation, I want to hear your last thoughts for what you think is the way forward for helplines, to sustain them so they continue to do what they need to do. Like I said, not just for crisis, for mental health overall.
I think if I can add and build on to what Devika shared, right? Like I do see, I get where you're coming from, and that whole conversation about, okay, you worked at a helpline, is your experience even relevant, to work as a counselor and stuff like that. But I just want to point out, like now that I am working with a helpline which sustained through the whole pandemic and all, I feel like there is definitely a steady shift about the counselors' work at a helpline. I feel like people are definitely, even the people working in the field are a bit more rather accepting, and rather are very intrigued and are interested in helplines as well, because I think pandemic also showed what would that mass intervention and what would community mental health can look like for India specifically, at least, and how easy it was for people to sort of reach out, get help. And as Devika said, and I want to just point it out to like even if you talk about say in-person therapy, we can't always offer that cure eradication anyway. Like there is always limitation to how much deeper work can be done for certain type of concerns anyway. So I feel like yes, of course, there is no one denies like the limitations that one can do over telephonic or technology assisted therapy at large, but it showed like the dearth of mental health resource that we already had as a country, right? And then the pandemic just like highlighted the need for it. And I feel that hopefully like people are able to see then like the difference that it makes to have access to basically affordable mental health care. And I do look at helplines as one of these affordable mental health care systems where like MannTalks is free, but I know there are some other which are by either peer-led, volunteer-led, or therapist-led helplines. Some of them are free, some of them are very, very affordable as well. And I think that definitely helps fill in that gap, because the last research that I did for some project, I got to know that there is 97% of gap, right? Where people that the need for mental health interventions and available therapists, psychiatrists, and MHPs in India, right? And this I remember was maybe 2019, 2020 early. So you can see that there is already so much work that can be done, and interventions like helpline, which offer such community mental health support, I feel play a big role then. Uh, and also not keeping mental health elitist. That's another thing that sometimes does happen with mental health is it does become to some extent elitist, because you have to be able to pay, you have to be able to take time out to go to that, therapist, that psychiatrist. You have to be able to afford that time off. We used to get calls from day workers whose month like daily wage will get lost, right? If they have to, and that's the conversation that used to be there sometimes, that you're telling me to go to a psychiatrist, but then I will have to lose my daily wage for that day, because psychiatrist does not sit in Saturday, Sunday, or the days that I'm working, they are only telling me come on this day. So I feel like even for mental health in terms of counseling, there is that whole element of it being elitist, and helplines help offer that another angle there and make it more accessible for the masses as well.
I think this is the aim for the project and this conversation in the first place. Like you said, Meghna, that public mental health is the answer to the gap that we see between this such a large desire or need, more than that, there's such a large need for the mental health interventions, and helplines are a good answer to a big part of it, and all of your experiences seem to add to that. Sidhhant, what do you think is the way forward for helplines, and especially the public health component of these helplines going forward?
I think there are two fundamental questions which each of us need to keep going back to. Who are we doing what we are doing for? And is what we are doing going to enable them, serve them? I think these two questions we keep at the center of all that we do, and I think that's true what all patient-centric or person-centered approaches is we'll be able to move away from all that's mental health in India needs to move towards. I think in helplines, what we need to be very thoughtful about is not look at mental health as a silver bullet. Mental health has a certain role to play, and we also need to ensure that there is no duplication of efforts. What has also happened post-COVID is pandemic has shown that a model like helplines work, but there's a need for a lot many models than just a helpline. So there needs to be better integration, there needs to be better diversity of solutions, and in mental health, you already know it's not a one-size-fits-all, right? So what we need to really be thoughtful about is not put all eggs in the basket of helpline. There's a definite and a key role and a very important critical role which a helpline offers, which is of bringing equity into mental health, being able to really work on the preventive, promotive practices. But there is a greater, you cannot not work on increasing the number of or strengthen district mental health programs. You have to strengthen the tertiary care centers too. You also have to be able to offer fair wages to the mental health professionals. I think it's something which all of us have experienced at some point, right? And I'm the only non-mental professional here. I'm a mental development management professional, and I still know what the entire crisis of what the pays are, right? So, and it's something which has to happen, right? In terms of when we speak of a country which is really banking upon diversity, that's a word that we love using about India. I think that's also what we need to put in a basket of mental health solutions, that we need a diversity of solutions. There needs to be a pluralism of thought and acceptance that there's a role for a psychiatrist, there's a role for a psychotherapist, there's a role for mental health social, there's a role for even teachers. And I think each one of us has to plan a role. And when we really speak of the task shift model, I think there is a responsibility at each heads. And then when the more that we know our own responsibilities and start taking it up, right? When we speak of rights, there are also duties attached to rights. And I think similarly, when it comes to mental health, there are, when we look from justice or a equitable lens, I think that's the same way it also looks to mental health. Each of us has a responsibility for our own mental health and also those of around people around us. I think that's something which we need to look more of. And I think fundamentally for mental health, I would really watch out for is in terms of not duplicate efforts of helplines. We don't need to have every state start its own helpline. There's already a couple of programs the central government has launched. And if you look at the numbers, they are abysmal. There's no uptake for the helplines. And there's this capital resources are just being wasted there. And that's something which we need to be thoughtful of. A model which has worked in a certain setting will not work in a different setting. And should really know the context, because mental health solutions are all about context. And that's something which one is to thought of in terms of really avoiding duplication efforts, really bringing solutions that are localized, vernacular centric, and really at the center has the people at what we do.
Like you said, duplication of any of these solutions is not going to be the answer. It needs contextualized answers for these mental health concerns. And I really agree with how you said it needs to be in languages that people feel comfortable talking in. And language is such a big part of mental health overall. And naturally, these helplines also have tried to include as many languages and counselors and volunteers who speak in those languages. And in all of the other mental health efforts, it would be important to include that aspect as well. Great. Thank you so much, all of you, for sharing your thoughts about and your expertise about the experiences you've had. Can imagine it's not easy going back to these experiences as well. They wouldn't have been easy experiences in any way. But thank you so much for sharing that, for going back to that part of your professional and personal lives and bringing that out for our audience as well. We can now move on to some Q&A and see if some of our listeners have some questions for any of you. And yeah, just take them before we wrap for today. I see some people have mentioned in chat that they have questions. If you have any questions, you can, okay. I see somebody has raised their hand. I'll just unmute you. Can you just unmute yourself, Preeti, and yes, ask your question. Thank you.
Yeah, hi. First of all, am I audible? Yeah, thanks for the whole discussion. It was really interesting to hear all of you. I just had one question, like more of a query. So personally, I feel during the pandemic, the discussion about mental health really opened, like the topic, the concept. I was just wondering while hearing all of you that as therapists, like how do you feel whether the topic of mental health is the relevant in a similar manner as it was during the pandemic, or has it is it like it was before it? Like from my experience, I feel that people do not really go for counseling, helplines, all of these things. So from my experience, I really saw a boom in mental health discussions during the pandemic. So what would be your take upon it?
Do you want to ask this to somebody particularly, or any of you can answer?
Like I'm okay with anybody answering it, but
Devika,
I was
you're off. Right, Devika, you're
yeah,
off.
please.
Yeah.
Okay, thank you. Thanks, Kriti, for that question as well. Mental health existed before COVID and it will exist after COVID, which means mental health need existed before COVID and it will exist after COVID as well. What happened with COVID is that suddenly everybody started to talk about mental health because I think it was a collective experience why everybody was like, I'm not feeling okay. And because this virus was such an intangible thing in general, everybody was able to relate to being scared about something you can't see, and that really sort of helped reorient them towards, okay, you can be scared of something that's not there and that can impact you. So I think it opened up floodgates. Unfortunately, what I'm also seeing, I do agree with you that there has been a dip in terms of people, even organizations, governments talking about mental health right now, because it was almost like this was when it was COVID and right now we don't need it. Unfortunately, I'm seeing that shift again. It's not the most encouraging, but the need very much exists, and it will, if I'm with a heavy heart, I will say it will only increase because of whatever the world is going and wherever it's going. So yeah, that's what I wanted to say. Thank you.
Thank you, Devika. Thank you for asking that question as well.
Can I just add to what Devika said, if that's okay? I just, what you said is very correct, right? The need is always going to exist. But I do feel that there is a element of here now comfort and discomfort that came in, that with COVID, with the restrictions, with the limitation of your activity, and drastic change in how your everyday life looks like now, right? Your access to your privileges that you had earlier, as simple privilege of taking a walk when you want to go for a walk, needing, even when the things loosened up a little, needing to wear mask, visors or something like that in order to enjoy even the basic little things of life. I think that brought in so much of that sense of discomfort that people had no other option but to notice the mental health effect that it has on you. And I think, obviously, as Devika said, that it was heightened then, and then that's when it came in. And I feel the reason that the dip has now happened is also because now all of that access is back again, right? Like, you can go out to have dinners, you can do whatever your walks every day, you can do this, you can do that. It's easy for me to now ignore some of the things that I may still benefit from in therapy, but now I have these other things that I can sort of use to sort of balance it out. And I think that's where that comfort, that status quo to some extent is sort of getting settled in, and I think that brings that dip. So yeah, just wanted to put that one forward.
Yeah, thanks so much. Yeah, absolutely.
Thank you. Thank you. Because even I'm sorry if I'm interrupting. I just realized that, yeah, because even I can see the commitment to therapy or, showing up for sessions has also decreased after the pandemic. So it is quite disheartening, but I really am hoping for something positive to happen in the future. So thank you.
Thank you. Any other questions? Okay. Yes.
Yeah, hi all. I feel so grateful to this conversation. Thank you so much. And I'm curious, this is specifically about the helplines. Now that you have the systems and the checklists and a better sense of what's needed for the volunteers and for the dispatchers and for each role, does it feel like the helplines that you work on are at a place of maintenance, or is there big system improvement that still needs to happen for it to be an ongoing resource? I can try to ask this in a different way if it doesn't make sense.
So I could possibly take the question and then also add into the previous question as well. I think adding the point to the previous question, I think what Devika and Meg have already shared. I think what they also have to see that there's also been great silver lining with mental health and COVID. If you look at the baseline pre-COVID and baseline post-COVID, the help-seeking behavior has increased net. And that's something which you also need to see that there has been an uptake post-COVID. If you also look at, I think people really looking at considering as career opportunities or wanting to start something in mental health, number is a lot higher. I think those are also great successes for the sector, which you also need to acknowledge. To Lillian's your question, I think definitely there are greater structures and processes in place. And if I speak of my work or the work that I've seen around the helpline approaches, I think the greater mandate for running continued helplines has been taken out by the government. They already, like if I speak of the country of India, there have been 2 centralized helplines have been formed, one under centralized Ministry of Health and one under centralized Ministry of Disability and Youth Affairs. And those something which have been taken up. I think, but what I was sharing earlier about the need to do consistent advocacy, because what we also seeing internally is there is a very, very low number of calls coming in. Because of what already have been shared that post-COVID, because when you're not cooped up with your own self anymore, with your own thoughts only anymore, you have greater distractors, right? So what you also have noticed in terms of a number of calls coming to even these state helplines, which are backed by the country as a entire Department of Health backing it up. The numbers are not where anywhere they were even after early months of COVID. So what we certainly have for is, I think, greater awareness how to respond to disasters in the future. That certainly is in place. If I speak to the Indian context, the National District programs, or also the NDMA, which is the Disaster Management Authority of India, has clear guidelines in place. Just, I think, a couple of days back, they were piloting a mechanism to send out emergency notifications in India to all the registered mobile numbers in Indian geographical nature. So they have been great technological improvements, which certainly not will come in terms of help for just as mental health is component, but also in terms of, say, floods, when it comes of cyclones. And that's something, so processes we've all learned from these helpline experiences. I think in terms of mental health under the mental umbrella, the helplines for the mental health umbrella, I think we need to very thoughtfully think of, do we need to start another helpline? There's so many helplines in place existingly. Meg mentioned about iCall. It's been doing remarkable work for almost a decade now. There has been Sanjeevani, which does remarkable work again, and a couple of more which have been doing these work for decades. And I believe the innovation through both COVID and pre, what had happened to happen in the space of helplines has happened. It's a very well-defined, innovative model now. You pretty much have a booklet that you can pick up and start implementing. Of course, the context has to be then localized to whatever the geography is. What we really don't have really figured out as of today is in terms of how to do consistent advocacy and have people look at seeking support and to recognize that if they are going through these experiences, to reach out. I don't think we have an answer for that today. There are multiple efforts going out, but that's something which I think it's something which we will keep experimenting with, and through experimentation alone is the way to get there.
Absolutely. Like you said, that it's not just one model that we can depend on forever, as even inside the bigger umbrella of public mental health. It has to be advocacy, and it has to be capacity building and just strengthening the resources we have, and obviously making sure that if we are starting any initiative, it's contextualized, it's built into the system, and knowing the needs that it has. Well said, Sidhhant. And any other questions that we have for our panelists? No, I don't see any more questions. All right. Again, thank you so much, all of you. It's been such a great conversation to hear from your experiences and to really delve into what not just the experience of a helpline in a pandemic was, but it also what it takes to do the non-glamorous act of maintaining and sustaining the efforts that are initiated, and to take them to the space where they can be beneficial, not just from a group, but for a larger community that wouldn't otherwise have access to any kind of mental health resources, especially in this variety. Again, thank you so much for your expertise, for your wisdom, for your time, and for speaking with me and for our listeners. Yeah, I would pass the mic on to Liliana to just, wrap our session up from here. Thank you so much, all of you.
Thank you so much to our speakers. And Himani, thank you so much for gathering us all here today. You were the mastermind behind this conversation and holding such amazing questions for each of our speakers that we are just so grateful to work with you on behalf of the maintainers and learn from you as well. So thank you again. If you would like to stay up to date with the maintainers and Himani's work, you can follow us on Twitter, Instagram, and sign up for our newsletter. I'll put a link in the chat, and we'll be following up with everyone with the event recording next week with additional resources and things like that. So yeah, thank you so much again, everyone, for coming, and we will be in touch. We will be in touch with you all soon.
Absolutely. Thank you.